it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're discussing multiple sclerosis. I'll often shorten it in this discussion to MS, which is a neurodegenerative disorder. Some people also call it actually an autoimmune type of disorder. Essentially what's happening is, if this is a nerve and this is the myelin sheath surrounding that nerve, whatever the process of MS is doing is it's eliminating that myelin sheath. And we actually need that myelin sheath to help with conduction of the nerve transmission of signals. So when you have that and it's gone, patients can suffer any number of issues, whether it's walking, whether it's remembering things in the brain. It could be something with manual dexterity, any number of things. Sometimes it's unpredictable exactly what it is that's going to be affected. Now, there's several different types of MS. I'm not going to go through all of them in this video, but some of them involve a continuous decline of function. Some involve a decline of function, then it is remitting and a sort of remission, and then it relapses again. So when it comes to stem cell therapy for MS, it really is the first option with a biologic that actually can modify the disease progression, maybe get a little bit of regression. But there's really nothing else to date that has been able to do that. I mean, there's some FDA-approved medications out there, but they really just don't modify the disease to a significant extent. So there have been quite a few studies done on MS, and it's one of the more common conditions that we treat internationally, such as in Pakistan, Mexico, and we've had fantastic results. What do I mean by that? Well, first of all, let's talk about what we use for treatment. So the stem cells come from umbilical cord tissue. In the past, we've used bone marrow tissue from the patient, adipose tissue from the patient, and what we found is that nothing works as well as umbilical cord tissue. I don't know exactly why. I know that there's much higher cell counts to be seen with umbilical cord tissue, much more active cells, much more pure cells, because a lot of the stem cells that we have in our bodies are, unfortunately as old as we are, so they just don't work as well. But at any rate, the umbilical cord tissue comes from a scheduled C-section from a consenting donor in the United States. And it's an FDA-regulated procedure where a mother's undergoing a scheduled C-section, so a month or two beforehand, she gets consented as well as screened. So our medical director will look at the blood work to look for any infectious diseases, look at the medical history, to exclude those who are smokers or into vaping, things like that. Now, normally after a scheduled C-section, the umbilical cord tissue is discarded. Not in this case. It goes in a sterile container to our FDA-approved lab in California, where it gets processed according to the FDA's strict regulations. So I can guarantee you that you are not going to see a higher quality assurance set of standards than what is in place at our lab in California. They are ISO 5 certified, CGMP compliant. There's 3 clean rooms where the processing of the tissue is performed. Testing is rigorous for any infectious disease, other pathogens, and after the processing is done, the tissue is cryogenically stored until all the tests come back negative. Only then can it be used for treatment, and we bring it over to Pakistan and Mexico on dry ice, so it stays cryogenically frozen. Only about 20 minutes before your procedure will the tissue be thawed out for use, okay? So with multiple sclerosis, the treatment is performed with a combination of methods. One is through a simple IV infusion. You pick the arm, it's a very simple IV. We give a multivitamin along with the stem cells. We use upwards of 100 million stem cells per treatment. It could be 50 million stem cells split up into 2 or 3 days for the 100, even upwards of 150 million stem cells. We want to make sure the patient gets what he or she needs to get the best outcome. We also use something called exosomes. Exosomes are stem cell byproducts, which have been very effective in what's called cell-to-cell communication to help with new neuron formation, as well as helping with stopping the demyelination. And there's some studies that can even show it can help with remyelination, which no other biologic or medication has been able to do that. So we also give the treatment through what's called intrathecal application. And basically that's a fancy medical term, which just is for a spinal tap with an anesthesiologist who puts the needle into the spinal cord area and then safely and very slowly administers the umbilical cord and exosome cells, although exosomes are not cells. They're stem cell byproducts. But at any rate, the procedure takes about 2 hours. It's very safe. Side effects we've seen to date have been very scant, maybe some dizziness, temporary lightheadedness, as well as maybe a low-grade fever for a few days to a week. Could be some nausea, maybe some back pain from the intrathecal for a couple days. What are the outcomes? Well, the biggest goal in treatment is to stop the progression of MS, and to help a patient stay in remission. We've had very good success with that to date, which has been fantastic. Now, what you see in the studies, and we've seen this many times as well, is if you get an MRI at the 6-month and 12-month point after the stem cell therapy, the inflammatory lesions in the brain, typically there's much less of them. And that's fantastic, okay? And sometimes patients do get some reversal of the problems that they're having. Ability to walk better, do things like lift up their quad better. The manual dexterity sometimes returns a little bit. You know, it's one of these things where, as I said, the biggest issue is we want to stop the progression, and as a cherry on top, you can often get some regression, but it's not the norm. So we want to make sure we underpromise and hopefully overdeliver, you know, if a patient sees that. Now, when you look at the studies, unfortunately, in our experience too, this is not a cure for MS. Can it dramatically improve and mitigate the disease? Absolutely. But a patient is going to need to have the therapy repeated. Now, most of the studies, and this is what we do, is usually recommended once a year, but there are some patients who are going to start to continue to progress after about 6, 8, 9 months. So they might want to have it done sooner rather than wait for the full year, okay? And that's something we talk about with patients all the time. And when it comes to the stem cell counts, sometimes we give upwards of 150 million stem cells. It's very important. And what you'll find is that most centers around the world underdose patients and overcharge, right? What we like to do is, you know, over calculate how many stem cells we're going to give, and then, you know, make it extremely affordable. It's one thing we've done internationally is make our treatments unbelievably affordable for patients. We do offer a free consultation. So here in Pakistan, the number to call to set yours up is 051-889-6711. We have several locations in Pakistan, including Islamabad, which is where our headquarters are, Lahore, as well as Faisalabad, and upcoming in Karachi and a few other cities. The location in Islamabad is at the Jahinga Multiplex near Golra Moor, H13, Islamabad. We look forward to hearing from you, and thank you for watching.